16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Good evening friends, we are back with yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Anupama Menon. As the saying goes, prevention is better than cure. In this talk show Health World, we have expert doctors from various fields offering you valuable information and tips on how to maintain good health and keep diseases at bay. Today, we are delighted to have with us Dr. Bushra Said Taj Hamza Al Sharaf, the family medicine consultant at Al Hilal Hospital, Salmabad. Dr. Bushra comes with a wealth of experience, over 21 years of experience in the field of family medicine. And today's topic of discussion would be hyperlipidemia, which is high cholesterol and hypertension. Thank you for joining us on the show, doctor, and welcome to the show.
Thank you.
So can we begin by discussing what exactly is hyperlipidemia?
Hyperlipidemia, it is a high cholesterol, which we have many types of cholesterol. Starting from the bad types of cholesterol, the first one it is called LDL, which is low density lipoproteins. And the second bad cholesterol is the VDRL, which is very low density lipoprotein, as well as a triglyceride. And we have a good cholesterol in our blood, which is called the high density lipoprotein.
Okay. So what are the different types of cholesterols that we have in our body?
As I mentioned, that we have three types, which are a bad cholesterol, and one type which is a very good cholesterol. We need it to be a very high as much as possible, and we are happy to see it even more than 40, reaching more than 60 of milligram per deciliter in our blood. And the bad cholesterol, they are the LDL, which we need to be a very low in our blood, which is it should be less than 130 milligram per deciliters, as well as the triglyceride, it should be less than 150 milligram per deciliter, and very low density lipoprotein should be less than 50 milligram per deciliter.
Okay, so triglycerides and LDL are the risk factors.
With the VDRL as well.
Okay, okay. And what are the risk factors associated with hyperlipidemia? What are the diseases that it could lead to if it's left unchecked or uncontrolled?
Another way we can say what is the causes of hyperlipidemia. First of all, it could be as a primary cause related in some family. Some of the genetics,
hereditary.
yes, it could be run in the family.
Okay.
And there is another causes, it is acquired causes, which it is a widespread now that a lifestyle changes has been happens. For example, as we are eating a lot of fast foods, a lot of fats in our foods, as well as there is less activities, as well as smoking, alcohol. They are all risk factors to have a high cholesterol in our blood, as well as obesity, overweight, some diseases, for example, thyroid with a hypothyroidism can be also as associated with high cholesterol level in our blood. Also, some types of drugs can be increasing the risk of high cholesterol in our blood. These including the antihypertensive medications, for example, the diuretics, beta blockers, or oral contraceptive pills. It is also considered one of the causes that risk for having a high cholesterol in our blood.
Okay. And what are the symptoms of high cholesterol? Are there any physical manifestation? Do you see it in the body in any form, or only when you get it checked you realize that you have high
Mostly
cholesterol?
of the times that it could be asymptomatic, that there is two main signs we can notice that there is a cholesterol ring, could be seen around the iris of the eye, and or a fatty flakes which is deposed on the skin. This is the two main signs, but most of the times it's like when we do a screening to check the cholesterol level, they notice that they have a high blood cholesterol level.
Okay, so and this testing, you mean you have to get your blood tested on fasting, when you're fasting?
Yeah, actually screening is a very important in detecting early cases of hyperlipidemia, that there is a high risk groups and there is the low risk groups.
Okay.
The high risk groups, this is running in a family having a positive history of hyperlipidemia, or they have a strong history of a cardiovascular diseases. So we are starting early screening for these peoples even from 2 years of age.
Oh, right from 2 years of age. Okay.
And in a low risk people, which they don't have a positive family history of hyperlipidemia or coronary vascular diseases, they are usually going to test between 9 and 11 years of age, or between like 17 to 20 years of age.
Okay. So doctor, what is a mode of treatment once a person is detected with hyperlipidemia? How do you go about treating it?
Yeah. First of all, we are advising the patients about changing the lifestyle, which is a very important to take care about healthy diet, to decrease the fat.
Exercise maybe.
Of course, yes, regular exercise, even reducing the stress, because the stress is main cause of all chronic diseases. Having enough sleeps, also as well quit smoking, alcohol, they are all play an important role for the first line management.
Okay.
Then we say the second line of management, it depends on the type of the cholesterol. We are choosing the type of the medicines. Either we can start with statins, and it is depending on the type of the cholesterol which is high in the blood.
Okay, and are these medicines harmful in the long run if you take it for a long period of time? Does it have any after effects?
Yes, there is a side effect of these medications. Mainly the patients, they are complaining of muscle cramps and muscle pains. And the most important, which we have to keep eye on it, is affecting the liver enzymes. So these people, they should be regularly follow up for their liver enzymes. And when it is very high, we have either to stop the medicines for the sometimes, or to be changing to another medicines which is not harming the liver.
And what are the complications that can arise from hyperlipidemia? I guess heart disease, as you mentioned, is one of them.
This is
what are the other
main complications of hyperlipidemia, because hyperlipidemia, it is a plaque of fats. And these plaques of fat, they can go to any arteries, either in the heart or brains. So it is one of the main causes of the cardiovascular diseases, of stroke, sudden death, heart arrest.
Heart attack.
And so it's very important for early screening, evaluations, and treatment.
And hypertension is also known to be a silent killer. I think that also plays an equally important role in heart diseases.
Yeah, actually all these chronic diseases, diabetic, hypertensions, and hyperlipidemias, they are a very important chronic diseases. They can cause to a premature death, which they can cause a lot of cardiovascular complications. Also hypertension, it can cause a renal diseases, can lead to end-stage renal failures, and the patients maybe at the futures they will need a renal transplant. And we noticed that the hypertension nowadays, it's increasing worldwide. Even the last studies in USA, they noticed that the cases is increasing up to double of the cases. And the non-communicable diseases survey in Bahrain in 2017 has been announced that also we have about 16.3% of the cases they are diagnosed to have a hypertension, and about 26.4% they have a high diastolic and systolic blood pressure, and the prevalence is increasing up to 38% in Bahrain for the hypertension.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Doctor, in your observation, the hypertension cases are on the rise, especially in Bahrain. So do you think lifestyle or stress plays an important role in this? What are the basic general causes of hypertension?
Yes, of course. There is many risk factors of hypertension. First is our lifestyles. Again, we said in hyperlipidemias that having a fast food with high salt
intake.
Yes. With a lot of fats, it must be affecting our blood pressure levels. And not to have a regular exercise, also this is another factors.
Smoking,
yes. Alcohol, obesity, overweight, these all risk factors could be as increasing the cases of hypertension, not only in Bahrain, but it is worldwide.
And what are the common symptoms? Because we normally say when we have a headache or we are feeling dizzy, then that's known to be one of the symptoms of hypertension. So is that so, and are there any other physical symptoms that one may experience?
Hypertension could be asymptomatic, but if there is a symptoms, could be a headache and can be affecting of the eye. They can have double vision or blurred vision. They can have epistaxis, which is nose bleeding,
Oh, nose bleeding is also a symptom of...
Yes, could be as a symptoms of rise high blood pressures. They can have chest pain, shortness of the breath, they can have vomiting, fatigue, and there is many symptoms which could be related to the hypertension.
And what are the factors that affect the reading of blood pressure? Because these days we all have BP monitors at home. A lot of times we do the checking at home itself, and sometimes there is a variation when we go to a doctor and check. So what are the factors that affect the reading, and how safe it is to check it at home, how trustworthy it is?
It is very important questions, because I got that questions from many patients. As you said, nowadays the blood pressure machine, it is available and it is cheap, affordable.
And it saves us the trouble of going to the clinic. To check
the first factors that affecting the blood pressure reading is the posture of the patient. How he is taking the blood pressure. Is he sitting in a right positions with supporting of the back, or is he in a supine positions, or sleeping positions? But the best posture for taking of a blood pressure is the sitting position with supporting of the back. And at least we don't depend on one readings. At least we have to take 2 readings at the same time. And sometimes in diagnosis of hypertension, we don't depend on one readings, at least 3 readings and a part of a 1 week between each reading. The second factors which is affecting the blood pressure reading is the circumstances of the patients, that he should be stopped taking any caffeine 1 hour before checking his blood pressures, and at least 30 minutes to stop smoking, that not affecting the reading of his blood pressures. Also the machine itself, that the cuff which is covering the arm, it should be at least 80% covering the circumstances of the arms. It should be about 80% length and 40% width. So if an obese or it doesn't cover 80%, it is usually giving a wrong reading of blood pressures. As well as calibrations of the machines, because it contains a mercury, so it should be checked at least 6 months, which is rarely to be done by the patients. It's very important.
Even the machines that we use at home, you say that it has to be calibrated every 6 months.
Yes, at least it should be checked and calibrated every 6 months.
And how important is it to treat hypertension? What are the complications that this can lead to if left untreated?
Hypertension, it is similar to hyperlipidemia, to diabetes mellitus. They are all considered as a causes of a coronary heart disease, congestive heart failure, stroke, end-stage renal diseases. So it's very important for screening of the blood pressures, and evaluations and management and treatment is very important from the beginning, before having any complications, that damage of these organs, and we cannot reverse that damage.
It's not reversible, so we have to
be for example, if there is an end-stage renal diseases, damage is happened to the renal kidneys, tissues and cells, we cannot go back to retain it to 100%.
It's very important to regulate your BP and monitor it regularly and make sure that it's under control. Doctor, it's time to wrap up the episode. So before we wind up, any final advice to our viewers, words of wisdom on how to prevent and control both hyperlipidemia, high cholesterol and high blood pressure?
My advice is lifestyle modification, healthy food, regular exercise, quit smoking and alcohol, and be happy.
That's great. Thank you so much, Doctor, for taking the time out to be with us and for patiently answering all our queries. So friends, as Doctor rightly suggested, a healthy diet is very important. Don't forget to exercise, and most importantly, don't get stressed. Learn to smile more. Be happy always. Wishing you all lots of happiness and good health always. Till we meet again next time, next Tuesday at 8 p.m. with a different topic. This is Anupama signing off. Stay healthy and stay happy. Good night.
Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330